These people are so thankful that they even have an opportunity to walk for a day from a village and come see you. And you are seeing them and not taking advantage of them and helping them.
Cornea specialist Dr. Ali Haider is helping people see the world.
I did ophthalmology, I did eye surgery so that I could do this. How many surgeries can you go to countries with a briefcase of instruments and help people?
Even as a medical student, Haider was making week-long trips to dangerous developing nations to perform eye surgeries for hours each day.
The week was composed of me going there, not sleeping for 3 nights in a row, sitting in a tent or a small room with flakes of paint falling from the ceiling, and just working non-stop from morning to night.
Haider found the work rewarding, but was frustrated knowing that it would stop when he came home. And that's how World Sight began. With the help of some prominent Louisville businessmen and Lions Club International, Haider began to establish eye clinics in developing countries, and he did it at very low cost. He mentors eye doctors already working in those countries and recruits them to spend 1 weekend a month in a remote location. Patients with no money and no access to a hospital have their sight restored for free. World Sight then pays the doctors roughly $20 an eye.
The greatest need is in places that are dangerous, where no NGO wants to go and freely work. Not many people want to go and work in Pakistan, for example, or Iraq, when there are bombs going on every day.
Haider has been kidnapped in Iraq. He has had malaria 3 times. He is married with 3 young children and cannot get life insurance.
Why risk your life, though? Because you go places, really, like you said, that are dangerous, and you have children, and you could very easily go to underdeveloped countries that aren't nearly as dangerous.
Because that's where the greatest need is.
Haider's family collects change all year for him to take on his trips. After a surgery, he gives each patient $5 for medicine and sometimes just for food.
There's so much poverty and suffering, and you see it and you can't do anything about it. And it's only increasing. It's not getting any better. But that doesn't mean we stop doing anything, you see. Our job is to still continue to do what we can as a human being.
Haider has now established remote eye clinics in Madagascar, Ghana, Pakistan, and Iraq, and is about to open another clinic in Ethiopia. But even that success has not slowed his own desire to go and work.
Over there I'm there to do the work. I go, fix their eye, and a lot of times they won't even see my face because I'm wearing a mask. But you know, in just that you're helping somebody without them really even knowing who and what you are, it's actually more gratifying.
This work has always been a part of Ali Haider. His father was the first physician in their part of Pakistan. He too would frequently treat patients with absolutely nothing to give him in return.
My dad, so I don't ever see him come to me and say, good job, I'm proud of you, you're helping people. No, but I can see it in his eyes that he knows that I'm doing what's expected.
Haider believes all people could have this same approach.
I believe everybody has a good heart. I bet you everybody around us, if they see the suffering of mankind, not through a TV channel, if they actually can see into an eye of an old man or a child who's picking food out of garbage, it will change them for the good. Everybody, all of us.
He says we just need to open our eyes to see where we can truly make a difference. Candace Clift, WDRB News.